Today, I am proud to join with my colleague, Senator Weiner, and stand as a member of the California Legislative Black Caucus, again in collaboration with the LGBTQ caucus, to highlight a critical issue facing really all of our communities. Together today, we will present SR 15, recognizing February 7th as National Black HIV/AIDS Awareness Day. We all remember the painful past. In the 80s, the HIV/AIDS epidemic took this nation by storm, cutting far too many lives short and leaving a void in the hearts of those left behind. It was the LGBT community that suffered the brunt of these losses, particularly African Americans within the LGBTQ community. However, since then, these communities have continued to work tirelessly to recover from the pain and the bias of that era, but progress, quite frankly, colleagues, has been uneven. In more recent years, HIV diagnoses among Black women have declined, and among Black heterosexual men as well. However, there were far too many years where those communities were not recognized and treatment dollars not directed toward their unique needs. However, among Black gay and bisexual men, HIV diagnoses have declined at a much slower rate. Due to systemic marginalization, Black communities continue to lack the resources and outreach to help in the fight against HIV. Similarly, stigmatization associated the illness often prevents members of the LGBTQ community from accessing critical protections and treatments against HIV. Colleagues, we can take this time to not only acknowledge the disparate impact HIV has had on Black and LGBT communities, but also begin to engage in measures that actively combat these burdens, ensuring that HIV/AIDS no longer takes the lives of valuable members of our communities. We, in many areas of the state, are facing a public health crisis across the board. The STI rates in all of our communities would shock you, absolutely shock you. And we've not experienced significant investment in many of these areas. Again, as we talked about the history with regard to HIV/AIDS and how it impacted many of our communities, we have not kept up around investments in terms of how it is now impacting other communities, heterosexual communities, women, and as my colleague from San Diego talked about, yet another community that's being disproportionately impacted by a virus that 40 years later now, we should all have a better idea in terms of how to prevent, how to treat without bias. And so I look forward to the ongoing conversation and talking about how funding really must follow the newly impacted populations and our broader conversations around public health and STIs across the board. With that, colleagues, I ask for your vote on SR 15.
Thank you, Senator Mitchell. Ms. Secretary, please call the roll. Ayes 37, no 0. The resolution is adopted.